Welcome to the latest Peer2Peer podcast brought to you by Rainer. After lots of live recordings at meetings around the world, it's nice to be back in front of the screen and the comfort of home to bring you this episode. Today, we're going to be discussing making the move from the Centurion phaco machine that's been the workhorse of cataract surgeries for nearly a decade to the Sophi phaco machine. It's not a small decision because for most of us, we make our livelihood from doing cataracts, so you want to keep doing them well. I'm joined today by two friends, colleagues, and experts in the area of phaco technology. We have Dr. Erik Mertens, Medical Director of Medipolis Eye Centre in Antwerp, Belgium, and a globally recognised leader in cataract and refractive surgery. Erik is a real pioneer when it comes to adopting new technologies. And we're also joined by his colleague, Vuijk, eye surgeon at Medipolis Eye Centre. I'm not sure if I got that name quite right, but close, thank you. And again, Dick is a trailblazer when it comes to cutting-edge technology. So thank you both very much for joining me on this episode. And welcome back, Erik. You're a seasoned campaigner of Peer2Peer.
Yeah, my pleasure, Ben, as always.
So what have you both been up to today? I hope that you're about to say doing really efficient cataract surgery on the Sophi machine, but what's been happening?
We did a couple of days ago. So we had our cataract surgery day 2 days ago. And with the Sophi machine, as you already mentioned, and it's nice to have that machine in our practice. And yeah, well, I think we can discuss why we changed it, and also Dick has was trained on as we said, an Alcon machine. When he came here, it was of course a big step. It's always when you change another environment. Other nurses, other microscope, and another phaco machine. He already had done in his training like a 400 cataracts, if I am correctly citing your numbers. He's of course, he already had a good foundation in cataract surgery, but still making a switch was huge. And I think it's very important to learn from Dick Vuijk and his experience in how he made the change from another machine to the Sophi machine.
Yeah, absolutely. Because I think many of our listeners will be similar to me and you, Dick, where we're Alcon Centurion phaco machine users, and really keen to know why you'd change and how easy it's been, because it is scary changing. I always think it's funny talking about another brand on a Rainer podcast, but when I came out of training, all I knew was a phaco machine is a Centurion, and the only lenses I knew were how to use a Zeiss lens. How wrong I was. But, was that your training as well, Dick, that it was very much like the only machine you used was the Centurion?
Well, mostly the Centurion, yes. I started on the Alcon Infinity. And after that, I had 9 months in a different hospital than my training center, and that was with the Ortli. And after that, then we started with the Centurion, and that's when the procedures started picking up. You're more at the end of your residency, and then afterwards I did a cataract fellowship in Rotterdam, and that was all Centurion as well. So I was fully focused on Centurion before I came to Belgium.
And Erik, what was your phaco device history? I mean, not that I'm calling you old, but I imagine you went back past Centurion.
Well, I started, not almost, 30 years ago. I used, during my training, also an Alcon machine. And then I switched to an AMO, the OPSIS system of AMO, also peristaltic. And then in 1997 or 98, if I recall correctly, I changed to the Millennium, which is from Bausch & Lomb, which is the Venturi-based system. Then the successor of the Millennium, the Stellaris. I also used the Cube, which is also a Venturi-based system. And then the Sophi came along, the Sophi system came along, which was actually, it has 3 pumps. It has 3 pumps. It has a peristaltic pump, a Venturi pump, and also a pump to have the anterior chamber depth, and of course to minimize surge, to have an active flow of BSS in the anterior chamber, to maintain your stability of the anterior chamber. So I never used a combination of this, and this was very appealing to me. I could change depending on which is soft cataract, it's a hard cataract. I have a myope, a high myope and playing with the settings, I can, doing the phacoemulsification in a different setting as a chopping and so on. So that was very appealing to me, and that's why I changed to the Sophi. On top of many other advantages as well. But this was, I must say, for me, as just only using peristaltic or only using Venturi, it was, my mindset had to be changed a little bit. But now I'm very happy. I can play with all the settings and switch from one pump to the other in one cataract surgical session. So which is, I think, very unique nowadays.
And Dick, do you change around during a list as well, or is this just Erik behavior and we should disregard it?
No, I learned from the best, so I started to do it the same way as Erik was. In the beginning, I must say I was very happy with my Centurion way of doing my cataracts. So when I came here, I tried to set up the Sophi machine in the way that it's almost mimicking the Centurion, right? So the foot pedal linear, not dual linear, continuous irrigation, just peristaltic pump, and go at it, like I was used to. And then yeah, and then I said to because the people from Sophi, they come around and they help you out with the settings, and I said, okay, but lower my settings a little bit compared to Dr. Mertens, because I was thinking he's probably driving a Ferrari, and I'll just I'll just go slow. And and then I did my first cataract, and it's not really working. It's not the right feeling. I cannot really grab all the quadrants nicely as I used to. So then I tried to do it this way, a couple of cataracts, and then the people from Sophi came by again, and we changed the settings again to make it a little bit more powerful, a little bit more like it still didn't working. And then one day I thought, what am I doing? I'm just going to go with the settings of Dr. Mertens. He has been using these settings, fine-tuning them for years and years and years, with his OR, with his nurse, with his instruments, with his femtosecond laser, with everything. I thought, okay, I'll have to just copy the way he does it with the dual linear and the switching between peristaltic and Venturi. And I went for it. And immediately all my cataracts went way, 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 way better. I started flying through them, so on a comfortable rate. So that made me very, very happy.
If I may step in and maybe tell an anecdote, when Dick started to do his cataracts, his second instrument to the paracentesis, if I may mention.
Go ahead.
He always took it out of the eye. And then
I've seen people do that.
And I thought, why are you removing your second instrument out of the paracentesis? I said, yeah, but it's for the stability of the anterior chambers. Well, yeah, it's a Sophi. You just keep it in, keep your second instrument in the eye all the time, and your stability will be good. And he said, oh, and since then, So it's you see, when you're trained in a certain machine, of course, you mimic it. Yeah, that's normal. But I was very surprised. I said, why do you do it? He said, for the stability of the anterior chamber. No need here. No need here.
That's nice. And so for people that are used to, the simple life of one machine, one set of settings, maybe hearing that there is a lot of, different settings, variability could be off-putting, could be scary to someone or intimidating. Do you have preset settings that you just go, all right, that's a dense one, dense setting. All right, that's a soft one, soft setting. You've got your settings sorted and you just go between them?
Yep. Well, Dr. Mertens has it set up in a way that he has one indeed for the cataracts, for the refractive lens exchanges. For the cataracts, he uses mostly the peristaltic pump. Then he switches to when he has a refractive lens exchange, it's the Venturi pump. And then there's different settings for myopia with lower pressure and lower flow, and
exactly
it, right?
We have like four settings, and then during the surgery you can adjust it, and that's also the very nice thing about the Sophi. It has a wonderful GUI, and I can tell my nurse, okay, I need a little bit more of phaco power here. Can you put it up like 10%, or I need the bottle lower or higher in these settings? But just little adjustments just to fine tune during surgery. And because it's so easy for the nurse to follow, she just has to do one step, and the settings are adjusted. So that's what we like about the system. And on top of that, talking about the peristaltic settings. So as I said, mainly I was a Venturi cataract surgeon, because of the other systems only could use a Venturi. My peristaltic settings, it's Venturi-like. When I do a dense cataract, so I told you I have the peristaltic settings, but the followability when you have your chopping done, the followability of those pieces are amazing with those near Venturi settings with the peristaltic pump of this machine with a very nice and stable anterior chamber. So I don't need that Venturi settings anymore when treating hard cataract.
And did you find transitioning between phaco machines, did you find it difficult in terms of complication rates? I just remember that when the Zeiss Quatera got brought around to our hospital to test out, I hadn't done a vitrectomy for about 3 years, and I had to do 2 on the same list. That's probably saying more about my surgical skills than the machine, but you know, a changing machine can be quite scary. Did you have any complications?
And we didn't have that with the Sophi system. I did not encounter any problems. Of course, we started with also like low settings, not too aggressive in the beginning, because you have to get a feel. And gradually, actually, in my second surgical day with the Sophi, I already put the parameters much higher, much more flow, much more vacuum settings. But we did not encounter problems, luckily.
That's really good. And when you were deciding about whether to try the Sophi, was there one particular feature that you were like, yep, this seals the deal. This is why we want it. It sounds like for you, Erik, that was probably the ability to change Venturi, peristaltic. Did you feel the same, or was there any particular feature that you really thought, that's what I want?
Well, they proposed to me to use the Sophi, and I'm always eager to like I said, I used the Quatera, I used just trying it and getting a feel around it. The same thing with the Sophi. I wasn't, because I was using the Venturi system, the Cube, and I was also happy with that system. And then the Sophi came along, and I tried it, said, oh, wow, this is interesting. And then I looked deeper into the possibilities of that machine, like the 3 different pumps, the settings you could change, but also you only had to use 1 cassette for a whole range of cataract surgery. So sustainability-wise, which is a big fuzz about the last couple of years. So sustainability-wise, it's great. Also money-wise, because the cassette is rather expensive, and changing it for every surgery, you can save a lot of money only using 1 cassette. Of course, when it is safe and we don't get any problems with endophthalmitis rise or something like that. So that's of course very important that we did not encounter any problems with that. So on that side also, it convinced me, and I bought the machine actually within 1 month after they presented it to me, because of all those features. Oh, you also have the dual linear foot pedal, where you can play with the settings when using your foot, which is very nice. You can play with the aspiration, the phaco power, and so on. And it's in the beginning, of course, you have to train yourself a bit, but it's like driving a car. Once you're used to it, you don't think about it. You hit the brake, you hit the pedal for speed. It's intuitive, and that makes our transition very easy, actually.
And how do you find it with complex cases? Because I generally feel like the middle of the road cases, you're reasonably dense cataract, most machines should be able to handle it. But how are you going with those super dense cataracts or the pseudo-exfoliative cases and that sort of thing?
We go for the peristaltic and do the chop technique, and it works very fine, very nicely. You're able to, because it has, with the peristaltic pump, it has such good grip on the lens or on the quadrants. It's very nice. You can do nice chops, and after that you can very slowly, if you want, very slowly, because you have to do linear. You can put on a vacuum, higher up the vacuum, aspiration higher, vacuum higher, and then you see these nuclei go in or not. Then you help them a little with your second instrument. And if it needs a little bit of help, just go to the side for the dual linear, give a little bit of phaco energy, and then zit, it goes faster. And this way your phaco energy time is so much lower than I'm used to with other phaco machines.
I must admit that's a huge difference with other machines. Normally my settings are like 10% phaco power when I'm eating the pieces. And when you get occlusion, it goes up to 20% for medium hard cataracts. And for really dense cataracts, I go to 40% and 50%. So I've never have to go higher than 50% phaco power with the Sophi system. And as Dick mentioned, the total amount of 100% phaco power is in most cases less than 1 second. And the really very hard, dense cataracts may go up to 5 seconds, but that's it. And on top of it, we never encountered a wound burn, or that's also more than 3,000 cataract surgeries. No phaco burn, no wound burn. I mean, so that makes me feel comfortable with treating hard cataracts.
Yeah, I remember using the Bausch Stellaris. That was my first time using a dual linear foot control.
Yep.
And occasionally I would find myself full on vacuum, no phaco. You know, it takes a little bit of your mind getting used to how to use it. Have you found that transition okay, Dick? Have you found that that's not been too difficult, or have you made those mistakes to me?
This is exactly one of the things that helped me back a little, just trying to stick to the linear, trying to keep everything the same as it was. And then I thought, oh, I have to try this. I have to something has to change. And then, it's so nice to have being able to just floor the pedal, having a high vacuum, and then still be in complete control with the piece at the tip. And then when you need it, just a little bit of phaco power. It was so much more easy for me to transition than I thought it would be. I would advise everyone to try. Just go do it and try it.
So guys, I work in a very efficient day surgery where I think I'm often the rate limiting step. I'm the slow step. Sometimes by the time I've turned around after one patient, there's another one waiting to be operated on. But even then, they're slowed down by moving the machine from side to side, deciding where to put the cables so our chairs can move around it. And I understand the Sophi is cableless. Is that right?
Yep. That's right. And it also is a very slim design. It's not a bulky machine, so you do not occupy a lot of space in your OR. Indeed, the foot pedal is also wireless. So when we do most of the time, also Dick is doing that, both eyes at the same time, whether it is cataract surgery or refractive lens exchange. So we sit temporarily, so we have to change positions. We move the phaco machine. But it's very easily. It's on wheels, no cables, and also just turning around the foot pedal. It's done in just a second.
I also like the feature on the foot pedal. It has a little lever. If you press it, it gets sort of wheels, and you can just roll it around, and then you press it down, and then it's stuck to the ground again. And
I've heard this. Kind of like a hoverboard, right? Like in Back to the Future. Yeah,
it's the minor details, but I love them. It's super nice.
I love those sort of points. It's beautiful. Does the battery last for a whole day? Like you don't have to plug it in halfway through the day?
Nope, no. We just, of course, it's fully charged when we start the day, and it lasts a full day.
And what do the theatre staff think about it? What do your operating team? Because realistically, we're just the technicians, you guys. It's like we just do the operations, but the real boss is usually the scrub nurse that's running this whole operation. What are they thinking?
Well, the feedback I get is because sometimes you need a little bit different setting. Sometimes especially me in the beginning, trying to mimic the Centurion, I wanted some stuff the scrub nurse didn't use with obviously with Dr. Mertens, and she was very easy to find for her and to change the settings just with one move of the hand. So which was very nice for me. Although finding out that just going to Dr. Mertens settings was eventually the best way.
Yeah, I think probably we'll need Erik settings, really. That's probably the simplest way to do it.
Yeah. And also when priming the system, it goes very fast in comparison to other phaco machines, which of course is, the scrub nurse also loves that, of course, that she's not waiting for the system to be primed and we can start the surgery.
This question, I haven't checked with you first, so you might say no difference at all, but do you feel as though, and this is probably just a gut feeling, do you think that patients have noticed any difference? Do you think that you've noticed any difference? I suppose the only difference would maybe be a faster operating time, less time in the operating theatre, that sort of thing. You're welcome to say no, Ben, no one's noticed a thing, and we can cut this question out. But has there been any noticeable difference to your patients?
Well, for me, it's that it's a completely different world operating here than in the Netherlands or in because here, both eyes, it's the low energy, super fast. You have the femtosecond preparation. After that, you do the cataract with the Sophi, and then you walk to the other side. You do the other eye. It's way more efficient than I'm used to.
Yeah.
So yes, I noticed the change a lot, and I'm very happy with it.
Yeah, well, but maybe is there any change, do you think, Dick, in pressure change when you enter the phaco tip, and you of course you irrigate the eye, you bring it on pressure. I can remember in the early days when I did it that the patient was like, they feel the pressure change. And we don't see that with the Sophi.
Not even with the high myopes. Maybe a little. Maybe seen it once in the past year, but
Now
that you mention it, that's something I see way less of. Yes.
I just really wanted to ask both of you, for surgeons that are thinking about making the switch, do you have any particular tips? Any sort of advice?
We have 8 clinics here in Belgium, and one of the clinics needed a new phaco machine. Of course, the usual suspects came along, and I just told them, like, why don't you just give it a try? Why don't you try the Sophi? And when you use the peristaltic, just use peristaltic settings. When you use the Venturi, just only use the Venturi settings. They're not a huge difference in settings in between those machines. When you feel you're doing your case and you find it's a little bit slow in the followability, you can raise your settings. That's not a big deal. So of course you have to fine tune it. But I always say, if you don't try it, you don't experience it, you never know what the potential benefit can be for you and your clinic or your experience in general.
Yeah, my advice would be, just do it. Just do it. Try to unlock the full potential of the Sophi, right? Because you can do it just only peristaltic and the way you want it, but there's so many possibilities. You can make your cataract surgery so much more versatile. You can have different angles of attack, as you will, to do your cataracts. Go and try Venturi if you're only peristaltic. Go and try peristaltic if you're only Venturi. Go for the duolinear and find out it's actually very comfortable and quite easy. And like Erik said, go slow first and then amp up your settings.
Nice. I mean, we've annoyed a lot of different companies tonight, I'm sure, but you're probably annoyed Nike there by stealing Just Do It. And that's okay. We can work with that. Well, that brings the latest Peer2Peer podcast episode to a close. There you have it, straight from the horse's mouth. 2 experienced surgeons who have been happily moved to the Sophi phaco machines and have continued to thrive and enjoy the benefits. It sounds as though it's a safe, efficient, effective machine to use, has sustainability benefits, and is also winning over operating theatre staff, which all surgeons know is the key to a happy life. Thank you so much, Erik and Dick. Keep up the good work, and I will look forward to seeing you in person at the next meeting. Thank you so much.
Thank you.
Thank you, Ben. Always a pleasure.